Obstetric Anaesthesia. Finding your clinic patients. If you're working in any of the obstetric outpatient clinics and want to find your patients, you will need to use the ambulatory organizer. Once you log into EPR, open up PowerChart and you'll be presented with this screen. If you have a different screen to what you see in front of you, click on the Home button and this will take you to this screen. You will now need to set up your ambulatory organizer for the clinics that you'll be working in. Once you set this up, it'll be a lot easier to re-access these clinics, but you will need to set it up for the first time. At the top where it says Patients For, and then you've got no resources selected, click on that, and then you have a search box. The way clinics work on EPR is they are assigned to a clinician. When you search for that clinician, then based on the dates that you're looking at, you'll see the patients who are booked in for their clinic. For example, the preoperative obstetric anesthesia clinic is booked under Alistair Fairfield. Search for Alistair Fairfield and here we have it. Click on the box and apply. Now you'll notice that there isn't any patients today because today is a Wednesday, the clinic's on a Friday, so I'm going to move forward, and then when you get to the date of the clinic, you'll notice that the patients now appear. You can do the same for the other clinics. So the obstetric high risk clinic comes under Dr. Elton. If you were to work in any other outpatient clinics, it works the same way. Simply search for the clinician under whom that clinic is booked under, and then you'll be able to access those patients. So let's take a look at the high risk obstetric clinic. Apply. And as you can see the patients, you can see the name of the clinic, what type of appointment, and so on. You can then see on here the time of the appointment for the patient, the slot that is being given to them, their details. If you mouse over, you will get more details about the patient. Under status, if you click on that, you'll see various options. You won't need to change these, but when a patient arrives to clinic, the secretaries will be able to confirm that they've either checked in, so when they mark these, you will know that your patient has arrived and you can go and get them. As well as this, you can also leave a note for your patients. To do that, click on the plus icon and you can leave a note here. And what this will do is leave a note for your fellow clinicians to be able to see if there is any particular actions that need taken, like they need a specific blood test, for example. If you wanted to see patients from a future clinic, you can do so by clicking on the calendar and choosing a different date. And you should be able to see patients that currently been booked in to future clinics. When you're on this screen, if you would like to access the patient's record, you can do so in two ways. One, you can click on their name, which is highlighted blue, and that will take you directly to the patient records on PowerChart. Alternatively, if you right click anywhere on that patient field, it gives you the option to go directly to specific locations within the patient records. So for example, you can go to the doctor's view, which will take you to the M page for documenting the outpatient or pre-op assessment clinic.